physical therapist on the internet.
Hi folks, I'm Bob Schupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Pumped up today, Brad. Today we're going to talk about how to treat knee bursitis, and we're talking about suprapatellar, prepatellar, infrapatellar, Pes Anserine Bursitis.
You're
What is
spitting
that?
out a lot of big
I
words,
know,
Bob.
I know, but we're
talking about knee pain.
We did a video on this already, and you can look it up. What is causing your knee pain? Is it knee bursitis? And if you look that up, it'll kind of give you a description of what those were and what those big words were.
And it happens to be in the program section.
Yeah, we'll talk about that.
Oh,
at the
okay.
end.
Yeah,
okay.
well, just hold on.
So we can provide some suggestions on how to treat knee bursitis at home. But the first question that needs to be answered, is, when do you need to see the doctor?
Yeah.
Because if you have bursitis, you could have an infection, you could have a fracture, you could have autoimmune disease. I mean, you know, if you were kneeling on your knee a long time and you got bursitis, it's pretty obvious that it's from that. But if it just pops up, you know, suddenly you get an inflammation on your knee.
With no apparent reason.
Right. Especially if you had a knee replacement.
Yeah, if you've got a knee replacement and you've got some redness, soreness in your knee, that's I would say better see the doctor to confirm what's going on.
Right. So once you've seen the doctor and you determine it's not an infection, then we can go ahead and you can try some things here. So the first thing, for the first 24 to 48 hours, you might try some ice.
Cold packs.
Yeah. And we have actually a video on how to make a cold pack.
Yeah, you got a rubbing alcohol and a bag.
Yeah.
Actually, you can use salt, too. I believe we have both options in there. Works very well. I've used them at home. I've had my mother use. Well, I had one patient use Jack Daniels. It's pretty expensive.
Yeah, that's an expensive ice bag.
Yeah, especially when his actually broke open and got in his recliner.
Oh, jeez.
Yeah, he was an interesting patient.
Yeah, that I should say. So you want to ice it, and a lot of times you want to, between the ice pack and the knee, you want to put a washcloth so you don't burn.
Yeah.
You know, to get the ice burn. Or
you could get a frostbite.
Type burn.
Just like clothing, you know, a pair of pants typically works well.
That'll work too, yes. And do it like 15 to 20 minutes. You don't need to do it any longer than that. So, you might also take, if your physician approves this, you might take an anti-inflammatory like ibuprofen.
Yep.
So you can also use, by the way, a bag of frozen vegetables would also work.
I always like peas.
Peas
would
work.
They seem that, as long as they're not frozen in a
form.
solid chunk, you have to break them up in there. And I wouldn't, after use it a few times and thaw and freeze and thaw, I'd probably not eat them. Yeah, put them in the garbage.
Good
Their work
point.
has been done.
Good point. Okay, you also want to avoid activities that irritate the bursa, like kneeling on it, you know, because a lot of those bursas, again, they're fluid-filled sacs. They're all around the knee, and it's, you know, you'll know if you're irritating by kneeling because
it hurts.
Yeah,
it's pretty sensitive tissue.
Even repetitive activities can irritate a bursa once it's irritated already, like walking, biking, running,
up and down a lot of steps.
Again, it shouldn't be rocket science here. It requires rocket science. If you're walking and it hurts, you know, you're going to back off right now. So, all right, so we're going to show you some suggested exercises. One is, I just want you to bend and straighten the knee every hour or every half hour and do it like 10 times. This is good for the knee no matter what you have.
Yeah. Yeah, if you got just pain in the joint from arthritis, just ranging the knee out without putting force through it is good to get that synovial fluid going, get some circulation.
Now, with a lot of these bursas, they might be attached into tendons or muscles. So we want to make sure all the muscles are stretched out that affect the knee.
Right.
So the first one is you actually want to stretch the calf muscles. Brad, do you want to show that maybe over?
Sure. The easiest one, if you as long as you got a wall and a solid wall and a floor, you're gonna bring, this is the foot I'm stretching. This one is just here. Point the toe towards the wall. Straighten the knee out. I always tell my patients, pretend your heel's glued to the floor and lean forward. Keep the heel down and get that stretch and hold it. Make sure you breathe and relax. That's so critical for a good, effective stretch. And then come back, bend the knee, keep the knee bent, keep the heel on the floor, and repeat. And you'll feel it stretches a different muscle, and it's important that you get both muscles. You can hold it 15 to 30 seconds. If you want to go pressure on, pressure off, 10 times, that works too.
Now, hamstring stretch, that obviously crosses the knee. You can do that lying down.
Yeah, yes.
You can do it without, really, you can just grab underneath your thigh like this, leave this vertical, and pull up like this, and just keep pulling to have a hamstring stretch.
Sure.
You can also use a sheet to hold on.
Sheet,
and
the belt.
A belt or a stretch out strap. Do we have one? Probably not.
Not handy right now,
Okay,
Bob.
and Brad, you just go ahead and put your foot up on
Yeah, if you're up, able,
surface.
you have good balance and you feel steady doing this.
and you have good back motion.
Yeah,
I mean,
you're not rounding
yeah, you're
over.
not rounding out. Good posture.
Shoulders back and just lean. You'll feel an isolated stretch on those hamstrings. Make sure you relax and breathe with all of these, and you're going to have a much better success on
Now,
stretching.
quadriceps stretch, that's a difficult one for a lot of people to do.
Yes.
I mean, you can do it lying down. You
Yep.
can actually, you can actually lie like this and grab your ankle and pull it back like this.
That would be sideline, right?
That'd be sideline,
Yeah.
right.
That's because you're on your side.
Yeah, you can also do it standing.
That's how I remember it.
Yeah, very good, Brad.
Yeah, standing like this, again, good balance. I always need to hold on to
hang
something.
on to something, right.
And if you go like this, it won't work. You have to good, tall, straight posture, and then bring the
Pull it
knee
back.
back, and you'll feel that. Whoa,
Knee
yeah.
into extension. So you can also stretch the hip adductors. That's the muscles inside the thigh here. So you can sit cross-legged. Let's see if I can do this, Brad.
It'd be like the clam.
Yep.
Yeah.
And you can use your elbows to push it down.
Yep.
I can feel that.
Oh, absolutely.
I also just do it like this, Brad.
Lying on your back.
Yep, lying on your
That's what
back.
I do too. Pull up. Grab your feet like that.
Oh, like this?
Yeah, that's and then push your out with your elbows.
Yeah. I don't do that.
Yeah, it's fun.
I just lie like this and I
Yeah,
go like this.
Both of them works. It depends on your joint configuration.
So you keep all those muscles stretched out. It's going to be good for your knee no matter what problem you have.
Right.
And also it's going to be good for bursitis. Now, how about some strengthening exercise? The
yes.
stronger the muscles, the less stress there is on the knee. So I'm going to do just some simple ones here. Straight leg raise.
Right. Yeah, you're not going to, go to the gym and get on the weight machines, although maybe it'd be an option. But these are, if your knee hurts, you got bursitis, you don't want to overdo it.
Yeah, and what we're doing here is really isometric, and we're also strengthening the hip at the same time.
Sure, yep.
Which is good for the knee.
Yep.
So, but we're going to do straight legs. I got this leg bent to kind of stabilize the pelvis, and then I bring this knee up to about that knee.
So this is the sore knee.
And that's the knee that I'm strengthening.
Yep.
And then you can, count to 10 and repeat 10 times. And you're going to go right around the circle here. You're going to go around the horn, as they'd say, Brad, right?
Oh, so you're going to do the side.
Sideline.
So he's getting that hip abductor, which is connected to the IT band, which goes down and crosses the knee joint right here. So we are getting the hip and the knee at the same time on this exercise.
And then I'll go lie on my stomach.
No, prone, huh? Keeping the knee straight.
Yep.
And notice how Bob does it, and he holds for a second or two, and that's critical. Good control. That control motion is really critical for
my
strengthening.
mic, but this is a little more difficult one.
Yeah, you know what I do with that one?
What do you do?
I usually take this
Just
leg.
go like that.
Yeah,
and
and,
like
and
that.
I feel a little more
A lot
stable.
easier.
It does kind of make your hip go back. It's not as isolated, but it seems like it's worth it.
I feel like I'm posing.
Well, yeah, you could be one of those. If you're on a beach and you could have a little Speedo on, and that'd really make people want to
leave.
Spew.
All right. Okay, next one is a really important one. This is the muscle they have found through research, Brad, tends to get weak with any knee injury or problem.
Sure.
So this is probably the number one exercise you should do.
What muscle are you talking about?
The quadriceps.
That's what I was thinking. It's kind of like if you have an ankle sprain, the hip abductor gets weak.
Right.
They have studies
Weird
on
thing, isn't it?
Yeah, it's just one of those things that as therapists we just drool over.
So we should have probably showed this one first because it's the most important one.
Yeah, well.
If you don't have time, just do this one.
Sure.
But you could take two pillows or just fold a pillow.
Yep.
And I'm going to strengthen this one.
Want the knee flexed a little bit.
A little bit. And I'm just going to push the pillow down into the bed.
So you're trying to keep this heel on the table or the floor? There you go. Yep.
And I'm doing an isometric quad.
Oh, all those quads are working.
Yep. And I would hold again. You could hold for like 10 seconds or repeat 10 times.
Yep.
And this is one you could do 3 sets if you'd like to.
And
you don't have to do it every day.
This looks easier than it is.
Right.
Even if you're a pretty strong person, you do this, you're going to feel those muscles fatigue. And the idea is that you're strengthening those muscles without irritating those sore bursas.
Again, what's nice about this is that everybody can do this one.
Right.
I mean, you can set it up that you can't fail.
Right. You could do that one in your bed.
So there's a hamstring one, Brad, you can do too. You could do this while you're sitting in your chair. You actually just put here's the leg that we're going to strengthen. I'm putting my heel into the floor and I'm pushing into the floor.
Pushing or pulling?
I'm pulling. You're right. You're right. I'm pulling this way.
You know, what I used to do with patients, but you got to have a good stool and a proper floor, is
the walking.
Yeah, the pulling like this. And it gives you something to do, and it really works the hamstring.
Right,
but
makes
most
you feel like
people do not have appropriate stool with
good
you
have an office chair.
Office chair, that might work, yeah.
You can just go around visit people.
I'm doing my therapy. But stay away from the stairs, you know.
Now this one, I got this from Kelly Starrett. He wrote The Supple Leopard.
Yeah.
And he talked about that sometimes these bursas kind of get stuck down with adhesions. Like he was talking about the prepatellar, no, not the prepatellar, the suprapatellar
above
bursa.
The kneecap.
Right above the kneecap. And I had trouble with this, and I did massage it.
Yeah,
I
remember
it did
that.
help.
Yeah.
So I don't know if it was the bursa or if it was quadriceps tendonitis, but either way, I took it, and you could do it with your hand, but the massage gun worked really well on this. I actually, I'm going to use the ball attachment here, and Brad came up with this one.
Yeah, if you use your fingers, it works, but your fingers get pretty tired and sore after a minute or two.
You want it nice and relaxed, so you want the actually supported. Brad actually recommended that you go across this way instead of going like this, which is pretty aggressive.
Yeah.
This is, you can ease into it that way.
Yeah, you get that cross-friction aspect that Syriax was so
and if you hit the bone, it's not uncomfortable.
Yeah, it's not banging into it. It's
right.
going across. So, yeah, it's just a variation that it's one of those little simple jewels. Or is it a pearl?
It's a pearl.
Yeah.
A pearl of wisdom.
I really never liked that. It just sounded stupid to me.
Don't you?
No, one of my instructors in school, your pearls. I didn't know what the hell. I didn't know what he's talking about. What are you talking about, pearls? It's an idea. It's a concept. But not a pearl. I'm thinking of jewelry, you know. Anyways.
I had an instructor that she was from, I don't know if she was from England or what, but she did a whole lecture, and she kept saying chuma. And finally, someone at the end of the lecture, one of my classmates, I'm sorry, we don't use this term called chuma. We don't know what you're talking about. She was saying tumor. She was saying tumor.
Really?
And she'd say chuma.
Oh, be darned. That's interesting.
Isn't that funny?
Okay. It is to laugh.
Remember this, Brad, by the way, this is a part of a series of videos on knee pain. So if you want to see the entire series, go to bobandbrad.com, go to the program section, and you can watch that video on bursitis, how to tell whether or not you have bursitis.
Right, which would be a good idea if you haven't.
And otherwise, you can watch the ones that pertain to you.
Right, and there will be a whole list of them. You just go through the titles, pick out. The title will, let you know if you should watch that or not because of your symptoms. And there's a PDF printout for every video. Print it out, push the button, click the button, print it out. Did I say that enough?
Yeah.
And then, anyways,
it
gives a preview of the full video. It gives the exercises.
A review.
Preview. What the hell is wrong with me?
We're having trouble.
It's a family show. Just cut it out. You'll figure it out.
Thanks.